So just to give you a little bit of background, before we start, just FYI, the meeting is being recorded for research purposes, and we will, if you have any objections to that, just please pop a message in the chat, and I'll go through some etiquette right away about where the chat and everything is. So Partners in Pain grew out of the Improving Pain in Saskatchewan collaborative research project. So the project's aims are to give pain a voice by bringing together people to share information and plan action to improve how pain is managed in our province. So the research project led to our first pilot series of the Partners in Pain webinars back in March of 2021, which seems so long ago now. The feedback from the pilot was very positive and led our team to seek additional funding to support the initiative. The project received the Community Initiatives Fund Community Grant in mid-2021 for an additional series of webinars, which brings us here today. And so all of this work is supported by the Saskatchewan SAS Pain organization, which is on a mission to help improve the lives of those who are living with pain in Saskatchewan. To introduce Dr. Donelda Gowan. Dr. Gowan is a registered massage therapist for over 30 years. She holds a Bachelor of Arts honors degree in psychology, a Master of Science degree in community health and epidemiology, and a doctorate in population health science. Dr. Gowan is an adjunct professor in the College of Medicine and an associate director of the Center for Integrative Medicine at the University of Saskatchewan. Donelda is a research chair on the board of directors of the Saskatchewan Massage Therapists Association of Saskatchewan and the chair of the Canadian Interdisciplinary Complementary and Alternative Medicine Research Network, INCAM. So thank you so much. I was tripping over my words there a bit. So without further ado, I will turn it over to Dr. Gowan.
Well, thank you so much. Thank you for the introduction, and thank you for the invitation, folks from SAS Pain, to speak about massage therapy and chronic pain. And thank you to each of you who came on today to participate in this presentation discussion. And I'm grateful for the opportunity to talk about massage therapy and pain, and I'm grateful for an opportunity to engage with each of you on this topic. And so I'm very much looking forward to this. I just have a few slides to share some information. And so I'll just share my screen here now. Massage therapy and chronic pain. So what I had thought would be helpful in our discussion today, just very briefly, in a snapshot of what I might want to share about massage therapy and chronic pain, would be to think about what I think that you may want to know about massage therapy and pain. And I think probably for most individuals, the top three questions are, or perhaps should be, is it effective, is it safe, and is it accessible? So I'm going to attempt in just this handful of slides to shed some light on those questions and hopefully answer those for you. So in terms of massage therapy and massage therapists, and I think it's important to have a discussion about each of these things. So massage therapy we define as a treatment process, and it's developed specifically to use soft tissue manipulation. So of course, the soft tissues, the muscles, the tendons, the ligaments in particular, and gentle stretching and mobilization techniques. And registered massage therapists, I think most of us appreciate, are trained in the principles of anatomy and physiology and pathology. And there's a smattering of theory and practical applications of massage. Massage therapists are also trained in remedial exercise and self-care, and that's part of the process of the treatment of massage therapy. And I also want to direct your attention to the fact that the Massage Therapists Association of Saskatchewan, on the website, there is a Find a Therapist directory. And so people often do ask, how do I find a massage therapist? And that's a very handy, very user-friendly resource for you to seek a massage therapist. And you can search by town, you can search by area, or you could search by therapists' areas of interest, perhaps their their individual training or experience, and that might be relevant for people with pain. So I wanted to suggest that massage therapy, in terms of massage therapy in Saskatchewan, what I would like to introduce as a bridging therapy. So thinking about Saskatchewan RMTs as regulated healthcare professionals, and a bit of background for those who might be interested, who are engaging with healthcare professionals from different fields, from different disciplines. The Massage Therapists Association of Saskatchewan has worked for decades toward legislation for the regulation of massage therapists in Saskatchewan, and certainly we are very pleased that there is a draft Massage Therapy Act, and the Massage Therapists Association and a working group are working together for the creation of the council, or I'm sorry, the creation of the College of Massage Therapists of Saskatchewan. And so I just think it's important to lay that out for patients and for other healthcare providers, that that's what's going on in Saskatchewan right now. But I often think about massage therapy as a bridging therapy. And I really think that it's helpful to think about this treatment process as support for getting from treatment and all the myriad of treatment that individuals with chronic pain are taking part in, to self-care. Essentially, massage therapists see their role as fostering and helping clients to get moving. And of course, we see our role as easing pain and improving function. And I think it's important to realize that and to appreciate that the process really is meant to be individualized. Oftentimes, massage therapy will be very multimodal. Massage therapists may have at their disposal lots of different tools tools and approaches that they'll incorporate based on an individualized treatment plan. In terms of accessibility, I think you might find it interesting to know that massage therapy in Canada is the most used insured non-medical health service. And so in a nutshell, millions of Canadians are using massage therapy for health issues and to promote wellness. In terms of massage therapy in integrative medicine, and I'm always interested in the historical developments from a perspective of how massage therapy fits within the system. And I thought that it would be interesting, and I was hoping that you would find it interesting, to talk a little bit about integrative health and integrative healthcare, and how massage therapy might fit into that for care for individuals with pain. So integrative medicine and health reaffirms the importance of the relationship between practitioner and patient. It focuses on the whole person, it's informed by evidence, and it makes use of all appropriate therapeutic and lifestyle approaches in healthcare professionals and disciplines to achieve optimal health and healing. And as you learned in the introduction, in 30 years of working in the field of massage therapy, this has been a mainstay of the approach of massage therapists for all of the time that I've been involved. And now we are starting to define that as a area of medicine that we consider to be an integrative medicine model. Said another way, this is essentially a new paradigm for medicine, so one that truly integrates on all levels the best of conventional mind-body, complementary, and non-traditional approaches to health and illness. And massage therapy is sometimes considered a mind-body modality, fits within that overarching theme of integrative medicine in that way as well. So I wanted to talk a little bit about, is it safe? And so I have perhaps a unique knowledge base and skill set with respect to safety in massage therapy. The product of my dissertation is this pantheon of safe massage that you'll see from my dissertation, and also soon to be discovered in a textbook for massage therapists on how to support safe massage. And I'm hoping that it will be equally useful to patients as well for supporting and making sure that massage therapy is safe. So if I frame that in terms of reducing risk, in a very brief overview, I want to say that massage can hurt and it can harm. And this is one of the fundamental questions of my own research, was to ask and answer that question. So I do want people to know that within the literature of patient safety, reports of a mild worsening of pain severity is not uncommon in the literature. And so I really want us to talk about that. And I also want people to know that severe adverse outcomes do occur, but they're likely pretty rare in the grand scheme of things. But I do want people to be aware of that, and both from a patient perspective and from a massage therapist and practitioner perspective as well. So I'll tell you just a bit briefly in terms of safety. So the pantheon that encompasses this idea of safe massage. Essentially, participants in our research project told us that trust is a really fundamental foundation of safety. And of course, this is true in engaging with healthcare providers in general, in all disciplines. But in massage therapy, there's some unique pillars. And so these three pillars support safe massage, and they're built on this foundation of trust. And the first pillar is this, we've described as the healthcare provider role. And so I want patients to know that they should really be aware of what is the education of the provider that you're seeing. Is it a registered massage therapist? If so, there's some expectation that there will be standards of care. You have some understanding of what the scope of practice is or must be for that individual, and you have some idea of regulation for consequences and accountability of the practitioner, and I want people to be aware of that as well. The second pillar that supports safety is this idea of protecting patient vulnerability, and this is what our research participants told us is really important. So for those of you who've been for massage, we can all respect and appreciate the fact that this is a potentially vulnerable experience. Clients or patients are being touched. There is a great deal of time in a massage therapy session, more so than you will engage with other healthcare providers behind closed doors. Massage therapists and other healthcare providers too are increasingly aware of the very important nature of trauma and trauma-informed care. And so it's perhaps important to consider that for safe massage, this idea of protecting patient vulnerability has become paramount, and I'm happy to discuss that further. The last pillar that we described as supporting safe massage, it can be described as treatment expectations. And so what I want to convey is that there's expectations of the client or the patient toward massage therapy and toward the massage therapist, but also vice versa. There's going to be expectations of the healthcare provider, in this case, the massage therapist, of the patient. And so it's very important that communication be robust. There's always the possibility, as people with pain know so very well, of having to manage procedural pain. Is this something that you are fully aware of what to expect? Could there be temporary worsening pain? Could there be bruising? Could there be a reduction in function? Could you feel that your mobility is compromised? therapist, and how will you work through that with your massage therapist? And that is an expectation that is easily managed through communication. Do you expect also that your massage therapist will take a thorough case history, that they will develop a treatment plan, that you'll work together at creating a treatment plan that shifts according to your individual needs? So that's the third pillar of supporting safe massage, and I hope that is of interest to you. I just wanted to very briefly talk about some of the research in terms of chronic pain. We know that musculoskeletal pain, back pain, neck pain, osteoarthritis is the most common type of chronic pain. And oftentimes we talk about the fact that there isn't a lot of research in massage therapy, but I wanted to share with you that from the research, there's a map that suggests that massage therapy has been the subject of more than 300 clinical trials and dozens of systematic reviews with respect to outcomes on pain. So there are things that we can say from the evidence about massage therapy and pain. So for example, this is a large-scale systematic review, meaning that they piled together a bunch of different studies and produced a meta-analysis where they put all of the study results together and are able to say that based on the evidence, massage therapy, when it's compared to no treatment, should be strongly recommended as a pain management option. I put the citation of the paper in there for purposes of future, anytime anybody would like to have a look at that. I also wanted to say, because I know this is really important for individuals with chronic pain and with chronic illness, I'm always pleased to share with individuals this seminal finding regarding anxiety and depression. So this is a foundational paper in our field, and the researchers concluded that reductions of trait anxiety and depression were massage therapy's largest effects, with a course of treatment providing benefits similar in magnitude to those of psychotherapy. And again, this was a meta-analysis, so this was pooling together data from a lot of different studies. And that effect was about a 75% reduction in anxiety and depression. And I know that that's critical to so many individuals who manage chronic illnesses and chronic pain. I thought it might also be of interest to talk about stress. So just a very recent paper from 221 that I liked the way this sort of talks about this modern evolution of stress management. And we know that mindfulness and meditation and cognitive behavioral strategies are increasingly recommended to offset stress effects. But massage therapy, yoga, things like stretching and progressive muscle relaxation, those might be considered sort of physical means of managing stress or physical means of stress relief. And I just want to share from this recent study that the results demonstrated that massage therapy and yoga of that list proved to be effective as standalone approaches for stress reduction that fell into that category of physical options alongside or as an additional option to some of those cognitive strategies. So I don't want to take too much more time here. I know our time is limited, but I often show this photo. I was gifted this photo of this massage therapist. She was a student of mine, and I just think she's a dancer in her pre-massage therapy life. And she gifted me this photo because I just think it's such an amazing depiction of the strength and the power and the grace that is inherent in this activity. And I think that it really encapsulates some of the things that we spoke about in terms of safety and effectiveness and potentially what to expect. So I'll end off with that, with what I think, and I hope you think is an interesting photo. And I'll welcome us to move on to the next step.
Thank you so much, Dr. Gowan, for your presentation. Does anyone have any questions? Quiet group today.
I'll ask a question.
Awesome, thanks.
I'm curious as to, because my talk coming up about my own experience with chronic pain is going to talk a little bit about physical activity and the role that's played. And you mentioned about, Donelda, about how massage can cause increased pain at times through the process. I'm wondering, there seems to be, I think, a real fear with people with chronic pain about trying things because of that fear of, is it going to make my pain worse? And what will that mean to me? So I'm wondering what strategies you would suggest you using to try and alleviate some of that apprehension.
Yeah, great question, and thank you for that. I would say that really open communication with your massage therapist, and to be absolutely welcome and free to voice those concerns. You will want to make sure that you have a dialogue with your massage therapist where there is that trust that your apprehension, your anxiety, or your concerns will be taken seriously and will be considered in everything from the treatment plan to the laying on of hands, how much pressure, how much the duration, the time of the treatment. All of those things are taken into consideration. So it is that would be my number one answer in terms of strategy would be to ensure that there is free and respectful communication back and forth between the massage therapist and the client.
Thank you. We have a couple other questions in the chat box. So the first question is, how long should a massage therapy MT treatment, so massage therapy treatment, should be to be effective?
Oh, that is a great question. Now, and I mean, it's a risky question to ask me again, because I could talk about the research on massage therapy for a long time and will be only interesting to a very few people. So I'll answer that question briefly to say, surprisingly, the research shows that very short treatments can be effective. Oftentimes in research projects, it could be a very short treatment, like a 10-minute treatment or a 15-minute treatment that shows statistically significant improvements in pain reduction or in increase in function, so things like mobility. So, over time, we used to think that massage therapy sessions needed to be long, needed to incorporate, sort of full body massage in order to have beneficial effects. And the research doesn't show that to necessarily be true. Now, I don't want anybody to interpret that I'm saying that all you need is 10 minutes or 15 minutes, because that's going to be certainly very individualized. And for lots of people, there is going to need to be that full body address. But surprisingly, a shorter amount of time can be tremendously effective too. And that's also something that should be certainly planned in accordance with your massage therapist in terms of what will be best for you. I know in my career, I have had individuals with other types of chronic illnesses where the duration was critical to the outcome and shorter was better. And of course, then I've had lots of clients and patients over the years where the opposite is true, where the duration really did influence the outcome, and that longer was better. So my recommendation would be, please feel free to experiment with that with your massage therapist, and they will certainly be flexible in terms of what meets your needs best.
Thank you. Two more questions, and then we'll move forward to the next speaker. So the next question is any one type of massage therapy better than others for pain management? And then in brackets, does it need to hurt to be helpful?
That's a great question. In terms of types of massage therapy, I think that, I can speak from the research evidence that oftentimes it is a fairly, structured session with what we might call a European classical sort of a massage therapy focus. So that's probably the most well researched. So in terms of, the type of massage that has the most evidence of benefit, it would be the classical type of massage that most of us would think about here in Canada, that we would get, because most of us are trained from a European tradition of massage therapy. The second question, in terms of does it have to hurt to help, I would say categorically no, it does not have to hurt to help. And that's something that I really want to encourage people with chronic pain to be really active participants in the decision making. Now, every individual gets to decide for themselves what feels good and what provides benefit. And that's what your massage therapist will want to hear from you. And so absolutely not. It does not have to hurt in order to do any good.
Thank you. And one more question. I'm curious to know if massage therapy can help with nerve pain.
Oh, yes, that is an excellent question as well. I think that it will depend on the diagnosis, and I think it will depend on a couple other factors in terms of the inflammatory nature of things. So we often consider carefully that issues where there's inflammation, massage therapy might be contraindicated, so it might not be appropriate. If we think about really, complex things like complex regional pain syndrome, those types of things, there isn't a lot of research, to my knowledge, with respect to massage therapy outcomes. But when it comes to other sort of, mechanical issues around nerve pain, different types of neuropathy, massage therapy can be helpful. And I would hope that, that would be something that would be best managed with a good case history and a good thorough treatment plan. So certainly, yes, likely, but there are some contraindications to consider.
Awesome. Thank you. So thank you so much for your talk. All right. So our next speaker is Don Ratcliffe-Smith. So welcome, Don. Don is an active 60-year-old. I'm aging you. I'm sorry. My dad just turned 65. So I'm stuck to 65 on the brain. 60-year-old who is born and resides in Saskatoon. His entire life he has participated in sports and physical activity. Don started his career working for the city of Saskatoon in the Leisure Services Department, and then became one of the early consultants working with the provincial physical activity initiative called In Motion. For the past 20 years, Don has been a private consultant focusing on encouraging and building active lifestyles in communities. Don is married, and both he and his wife love being active as they can, as they track during all 4 seasons, and also love to travel. So thanks so much, Don, for joining us today. And I'm sorry I aged you.
That's no problem, Michelle. Thank you very much for the introduction. And as Donelda said, I'd like to thank the Chronic Pain Network as well for the opportunity to participate in this chat today, in this webinar, and the opportunity to share my story. And I picked up on something Donelda said as well, that individual choices of how you deal with chronic pain and how you manage chronic pain really need to be respected. So I understand that the story I'm going to share is really just my story, and it may not be appropriate to others, but I think people that suffer from chronic pain actually have a lot of similarities in terms of some things that we go through. They may be shared differently, but I think the similarities are there. So I know for myself, there's been a lot of learning along the journey of my chronic pain. And so I just want to share a short snapshot of what that's meant for me. I am going to, if I'm not totally looking at the camera all the time, if I'm nodding, if my head's going down, I'm not falling asleep as a 60-year-old. I do have some notes that I'm referring to. So it's not that I'm nodding off. Maybe if I was 65, I might be, but I'm not there yet. Thanks, Michelle. So as Michelle briefly mentioned in my introduction, that I really have enjoyed a very active lifestyle, and it's been a really important part of my life. Even as a child, growing up, I was always a very active kid, whether it was sports or just playing outside, free play as we call it now. It was just very important for me to always be moving. And I was also really fortunate to have been able to have a career in something that I feel so passionately about in terms of getting people moving for their physical and mental health benefits. So I feel very fortunate in that way. I would go so far as to say that physical activity, sport, recreation, and leisure has really formed the core of who I am. And so much so that my social network of friends, the choices of activities that my family does, the choices that we make in our leisure activities. Michelle mentioned in the introduction, my wife and I like to travel, but even the travel choices that we make often center around physical activity. What can we do to be moving in all of those times? So it's just a really important part of who I am. And I wanted to share that with you up front because chronic pain has had a very specific impact for me because of how important physical activity and movement has been as a part of my whole life. So as a physically active person, I've always experienced some aches and pains that were associated with being involved in sport and activity as I was younger. And I'm sure like any of you that may be doing things that are active, you kind of learn to accept that and live with the minor irritants of and inconveniences of being active, that you might have some pain. And certainly as I've gotten older, I've realized the body adjusts differently and reacts differently to activities that I used to do quite comfortably. I'm feeling a little bit more discomfort as I'm experiencing those activities. I would say for myself, in terms of my chronic pain journey and story, it actually started with a trip to Australia. So I'm going to take you back to my 30s. I was traveling in Australia in my 30s with my wife. And of course, being the kind of person that thought I can do anything without any instruction, I saw a bunch of people surfing and I thought, hey, I can do that. So I went and rented a surfboard, took no lessons, and proceeded to go out into the ocean, into the big waves. And it was within no time at all that I was slammed headfirst into the sand. And I knew that something was wrong. I could feel a lot of pain at that time, more so than just, ooh, that was a nasty, nasty accident. I was able to get out of the ocean on my own, but I literally was laid up in a cot in a tent for 3 days. I just laid flat for 3 days. My wife was running out getting me, whatever painkillers were available. But I would say that was probably the start of my chronic pain, although I didn't realize it at that point. Because as a 30-year-old, I thought, hey, I can bounce back from this, I can recover from this, and I'll just go on doing what I continued to go on doing. So although I experienced a lot of pain at that point, I continued to be a fairly active person. But as the pain became more of an issue, and my recovery days after doing things, physical activity or sports, didn't seem to get rid of the pain. Because for me, I usually just took a few days after being active and pain would subside a bit. But it got progressively worse and worse and worse. So I did decide that I needed to check this out with my family physician, who then referred me to an orthopedic surgeon. And so at that point, and this was probably in my very early 50s, so I went a long time of just accepting pain. But in my 50s, it got to a point where I had to get it checked out. So I was told that I had severe degenerative changes in my lower cervical segments and a narrowing of disc space from my C5 to T1. So basically, the whole part of my neck down to the base of my neck was experiencing some issues. And I had severe degenerative arthritis in my L5 to S1. So again, in my lower back area. So for me, it was primarily my neck and my back that was causing me the issues around chronic pain. And then about 3 years ago, I started to suffer from chronic sciatic pain as well. And then around the same time, I discovered that I was having issues with my right hip. And again, through the orthopedic surgeon, got that checked out. And my right hip had osteoarthritis, and I was bone on bone with no cartilage left of that hip joint. About a month ago, I just found out that my left hip is the same place as where my right hip is. So they're both in pretty rough shape. But going back to what Donelda said, I think everyone experiences pain differently. And although I had a bone on bone situation with my hip, I was actually still able to stay fairly active without a really high degree of pain. So I know for some other people it would be very different, but I was just a very fortunate one, but it has got progressively worse. And of course, as we all know, due to a lot of uncontrollable circumstances, I've been on a waiting list for about 20 months for surgery for my hip issue. And now, according to my orthopedic surgeon, because both hips are very similar, he's hoping, fingers crossed, that surgeries will resume in 2022. And they're going to try and schedule my 2 surgeries, both hips fairly close together, to get that dealt with. And then I still have to deal with the management of the arthritis in my neck and my back. I would say that living with chronic pain and constant pain has had an impact on me, a real huge impact on me physically, but I would say also mentally as well. And that's where I think a lot of us share similar things. It may have a different impact, but I think all of us can probably attest to the fact that chronic pain affects us mentally. I really had to come to terms with giving up over the years the things that I really love to do and comprise such an important part of my life. And I totally understand how that may seem fairly trivial to people, that, oh, he had to give up playing a few sports, or he had to give up doing a few activities. But that's why I wanted to share at the beginning how important that was to my life. So giving up those things has been really difficult for me. I feel like I lost a little bit of myself because of the chronic pain. I've also had to become more dependent on others to assist me because of my mobility issues and pain. My wife literally has to do the heavy lifting around our house because I can't do that anymore. I'm very fortunate that she's a very fit and active person herself, so she's able to do that heavy lifting. But it's still hard not to contribute as much as I used to be able to contribute around the house and our yard. And I think that dependency that I'm feeling on other people now, and missing out on the social side of being active with my friends or teammates on a team, has been a really major adjustment for me. I've definitely felt a sense of loss, and I would assume that other people with chronic pain feel that sense of loss as well. And even everyday basic activities are becoming more and more of a challenge for me, such as getting dressed in the morning or bathing. I've had to find sort of retooling ways to sort of accomplish those activities. But as much as missing out on all the activity I was once able to do, it's been difficult for me. I'd have to say, though, that the determination to maintain the activities that I can do has really helped me cope with chronic pain. So that's been my strategy or approach to how can I live with this and manage it. I've tried through trial and error to find physical activities that I can continue to do, and I'd accept that there's going to be pain with them. I think just like Donelda was talking about the massage, that you have that discussion and realize there may be pain from this, but it's still doing benefit. And I've come to learn that being active, although there may be some pain, actually benefits and helps me deal with chronic pain. And I've been assured by my family physician and my orthopedic surgeon that staying active is actually a really good option for myself in terms of managing my chronic pain, but also helps me in terms of, I guess, recoveries down the road once I'm able to get surgery, hopefully, at that point. I've had to temper my expectations for myself. And so now I try to make a point, and it's as simple as going out for a walk. And I try to do that every single day. I walk slower and I don't walk as far. So I've adjusted my intensity and I've adjusted my duration. But I find that when I do walk now, because I've slowed down, because when I used to run, I used to do 10Ks, half marathons, those kind of things. The blinders were on, I'd look straight ahead and I'd run. And now when I'm walking at a slower pace, I'm actually kind of taking it all in now. So I'm appreciating the sights, the sounds, the smells. Walking outside has been really therapeutic for me. And it's been a discovery for me of how beneficial that has been. I find walking in nature is really relaxing. And so I seek out walking trails that have trees, are in nature, close to the river. And I'm really lucky where I live in Saskatoon, I'm at close proximity to those kind of things, so I can access them quite easily. And I found it very important. For me, I've come to learn that calming and meditative experience is one of, again, a successful strategy of dealing with chronic pain. So movement helps me, but kind of those down, reflective, meditative times are also very effective in helping me deal with my own chronic pain. I don't know if I mentioned, but I was a tennis player and I still manage to play tennis, but again, it's that adaptation. So I don't play singles tennis anymore. I only play doubles tennis. Singles had me running around the court too much. It was too high impact, but I'm able to continue doing something I really love to do by modifying it. So my modification was going to doubles tennis. What I found is that the joy I get from playing with my friends and the joy I get from doing something that really is meaningful to me outweighs the pain part that I may feel. And what I found really, really interesting and surprising for myself is that when I'm playing tennis, the focus is almost completely drawn away from the pain. I actually play tennis pretty much pain-free. I'll feel pain after. I can show up before the tennis feeling pain, but when I'm in the moment, it's amazing. I don't feel as much pain as I normally do. And I've come to learn that this is sort of like a distraction approach or strategy for pain. If you can find something that takes you away, that you enjoy, that totally distracts you from what you're doing, for me, I get that moment of living free from pain. So it's a really important thing for me. Because my pain is primarily in my hip and neck areas right now, and my back, I've been way more selective about what activities work for me. And I've just found that moderating the type of activities I do allows me to stay active. So right now I swim, I mentioned I walk, I'm able to do cross-country skiing, and it's just the nature of the activity, it doesn't cause me as much pain in my hips. And I mentioned about continuing tennis with modifications. For me personally, it's been important that I have not had to completely abandon those things that were important to me in my life, and that gave me pleasure. And I also know now that they are also good for me in terms of my management of chronic pain. I know that if I was a sedentary or if I became more sedentary, that could have negative impacts on my chronic pain. So I'm doing it because I love it, but I'm doing it because I also know that it's good for me. My physical activity has not been the sole coping mechanism, though, for my chronic pain. I wouldn't want to say that it's solved everything for me. So I've been a lucky person that has actually had some success with cortisone shots in my hip. It's provided me temporary relief from my pain. I've also accessed the supports of physiotherapists, chiropractors, massage therapists, and done acupuncture. So all of those have worked to different degrees, but I think seeking out lots of alternatives for your chronic pain is really important and has worked for me. I would say the journey to accept that my body no longer can do as much as I wanted it to do or expect it to do because of the chronic pain, and learning to live with chronic pain for the rest of my life has been an adjustment. And I'd say that there are times where I certainly wondered whether I could continue to live with chronic pain. You know, it got so bad being woken up all the time at night with pain and not having sleep for long extended periods of time. It really affected my mental health, and it was frustrating. But I feel that if you can take control of your body, you can also take control of your chronic pain. And so I think the first step is accepting the chronic pain, but not letting it determine what it is you can and can't do. You have to make those choices. Don't let chronic pain decide for you. One of the questions I was asked as part of the chat, and this is coming to a close here, is what is one piece of advice that you've received that's made a difference in your life or understanding about pain? And I know my answer would be that there are ways to manage chronic pain, but it just might require you to be stubborn and relentless and keep looking for the ones that work for you, because everybody's pain is different. Everybody reacts to pain, and we all have different journeys and stories about pain. But seek out help, seek out support, and seek out something that works for you. And I would be remiss if I didn't say, because this is who I am, I would ask all of you, if you're not an active person right now, I would encourage you to take that first step. And I literally mean taking a first step. If it means for you just taking a few steps, that's a great start. And maybe you can introduce an activity that you used to do that you loved, or maybe you can discover a new activity that brings you a lot of pleasure. Because I really have found through my experience with tennis that finding something you love that gets you moving could possibly provide others relief from their chronic pain. So I'll leave it there. Thank you very much for allowing me the opportunity to share my story. And I encourage all of you to, again, seek out what works for you.
Thank you so much, Don. That was so fantastic to share your story with us. And as you were talking about tennis, I thought to myself, oh, maybe that's something I need to rekindle this summer. I recently learned how to play pickleball. My parents taught me because they spend their winters in Texas. And so, yes, interesting that you shared that. So thank you. On to our activity. There's a question, sorry. Does cold weather bother you? It is really causing my chronic pain to increase. I see lots of nodding on the screens.
Yeah, for myself, I do find temperature makes a difference. I actually didn't take up cross-country skiing until about 5 years ago, and that was my adversity to cold. Like, I just didn't want to do cold. Most of my activity was indoors. So what I have found is if you have the right equipment for outside activity, and so I've learned the layering principle in terms of clothing. I invested in really good boots and mitts and things like that. And truly what I found with my cross-country activity is that after 5 minutes of building up internal heat, I am taking layers off. But I think it's important to investigate, do your research about proper equipment if you are being active outside, because it can make a huge difference.
Very much so in our Saskatchewan winters. So I agree with the layering principle for cross-country skiing. So thank you so much. Someone said any temperature change can make a difference. Yes, I agree. I have a very sore knee. I smashed my patella in my early 20s, and yeah, I can tell when a temperature change is coming because my knee throbs. So all right, so our activity is courtesy of Erin Sobkow. And so Erin is a massage therapist and has been for 22 years. She's owned her own clinic, worked for someone, and for about the past 5 years has worked out of her own home in Yorkton. The part Erin loves best about her job is figuring out what muscles are affected and using different techniques to treat them. She loves when she can help people get rid of or decrease their pain. Erin is also a certified Iyengar yoga instructor for the past 18 years. I Googled how to say that because I didn't know. She teaches English online to foreign students, and she facilitates online the Women in Leadership workshop series for the Canadian Women in Sport. Erin has 3 teenagers who are hugely involved in sport, which keeps her and her husband very busy chauffeuring everyone around, but they wouldn't have it any other way. Erin is thrilled to be involved with SAS Pain in helping to present this pertinent topic of pain relief through massage therapy. So thank you, Erin, and I will turn it over to you.
Thanks, Michelle. Dawn, your story was really interesting to me. And I worked as a community consultant with Parkland Valley Sport, Culture, and Recreation for 5 years. So I really get what you're saying, and I agree. Be active, be active. And Donelda was actually my second year massage therapy teacher. So she is someone that I very much admire. And currently we sit on the MTAS board together, and really look forward to hearing her speak as well. So with self-massage, there are a number of things that you can use and tools that you can use. I have a huge collection myself, and I find that I'm always self-massaging myself. So I'm just going to start from the head down. And if you guys want to do some massage along with me, you're more than welcome to. And I'm actually going to get up onto the wall and down onto the floor. So I'm going to be very active. The first thing I'd like to start with is like head and neck. And so I have something like this that I bought that I can hook. There's 2 roller balls, but they don't actually move. They're just stationary. I hook it into the back of my neck, one on either side, and I can pull and I can adjust to make it comfortable. Can you see that well, or should I move a little closer? And what you can do, or what is really beneficial to do, is to start to do some movement too, so that you're not just applying pressure, but you're also starting to move. And it seems the movement with this stuff makes the muscles release even more. So I don't know if you guys are moving when you're doing your self-massage, but it is so important to do. So I'm hooking into my muscles, and I'm moving. I feel the stretch. I can feel it. I can apply some more pressure. Use my breath. Exhale. Inhale. And you can work up and down your spine and even get into your sub-occipital area with something like this as well. A tool that I do not have, but I should purchase because it's amazing, I've used it at my aunt and uncle's house, is the Theracane. So, do you guys have a Theracane? Thumbs up? Yes, it's great to have. And what you do with your Theracane, I'll pretend this is my Theracane, you can actually hook it into the top part of your trapezius, your levator scapula, pull down and move. And it just gives that great stress relief for your upper shoulders. So you're hooking it. You can use your fingers, you can use a little tool, but the Theracane seems to really work. So you apply a little bit of pressure and then you move, you hold it and you come out of it. And it feels great to be able to do that. The next tool, and you guys easily have this, Don will have this for sure, is a tennis ball. And you take your tennis ball and you put it into a sock. So I actually borrowed my son's soccer socks. The longer, the better. And what you can do is you can hook that tennis ball into, I'm going to move a little bit here. So I'm at the wall and the tennis ball is between my shoulder blades. Oh, let me get it there. And so at the wall, I can move up and down. So I'm holding it and then I can move up and down. And if I want to get both sides at the same time, I'll put one in each. That's a really short wall. But yeah, a long sock is great because you have the ability to also pull it and move it as well. And that feels really great. And you can move your shoulder blades as well. Do some breathing as you do it. You can move your arm as you do it. Anyway, you can move your neck as you do it. So really, I would say use some movement when you're doing self-massage. I also have some little tools that I bought, I think at a, Don's saying a lacrosse ball, and that works well too. They're a little smaller, right? So might be a little easier. Lacrosse balls are good too. These little tools, handmade tools, and I love these. So not only can I get into that spot like a Theracane and move, but you can use these all over your body. You can, with your hand, if you have hand soreness, I don't know if you can see this part, you can actually get into this hyperthenar eminence that people have a lot of pain with, and you can just hold it there. If you have sore thumbs or arthritic thumbs, this works really great. If you don't have something like that, you can use a Sharpie. So here's my Sharpie, and I'm just holding it. I can also do it on the other side. And when you do self-massage, you want to make sure that you are not massaging on your joints. So now here's my arm. I'm going to use the same tool, and I can gently move it up my arm. And I'm not using lotion. I could use lotion for a little bit more glide. This is more of a myofascial thing when you don't use lotion. And you can apply as much pressure or as little pressure as you need. And for me, I just did massage this morning. This is feeling great for my arms. So I'm just slowly moving up. You could use your Sharpie too, right? Use the end of your Sharpie and apply as much pressure as you want. This area is usually sore for people, so you can get into that area, making sure you're never right on the joint. Never here. You can also do it on this side as well. And again, you can do some movement. So I'm holding this and I can move my hand, and it changes what it's doing and how it feels. Okay, so now I have this tool as well. Does anyone have this sort of a thing where you can, on your leg, you're massaging yourself with this. You can do it on your calves. Can you see that in my calves? It feels good. It's really stimulating. You can, usually your lower body is where you do it because you need two hands to really get a good grip with this, but it works really well. And my leg already feels invigorated and alive. And I did this for just, 15 seconds. So getting something like this, excellent idea. Oh, one thing, this little invention, Donelda, we were doing this at our last MTAS board meeting just in November. They passed these around. And if you have arthritis or sore fingers, we just took them and we were pulling. It's like a little myofascial release. And we did this a lot through the meeting. It felt great. And I'm starting to get some arthritis in my hands and fingers. I can feel that, I know, just from massaging. And honestly, I swear, for 2 days after, my fingers felt better. So I'm going to start to do this more often and see. And it's just an easy thing to do. You know, to get this off, though, you have to push in and take it off. Does anyone have this type of a tool? This is another very handy tool that you can use as a Theracane to push here. You can massage your arm. You can do these circular movements as you go as well, and as your legs, with your legs. I wanted to show you quickly with your legs as well. With these little tools or with two Sharpies, you can work the sides of your legs. So if you have hip, I don't know how easy you're seeing this, but you can get into your hips. You can work down your legs like this. It seems most people somewhere in your outer leg here, you have a point, and I can find mine. I'm on mine right now. That just kills me. And I'm getting on that point, and I'm just going to do some movement. I'm just moving these. Or you can go up and down. So for your IT bands, this works really great. Okay, I'm going to move to the floor, taking myself to the floor. 1 second here.
Erin, as you're moving to the floor, some of the questions,
Okay.
The first device is where do you find your devices that you've
Well,
had?
we can get ours here in Yorkton at Flamin Fitness.
Okay.
So I don't know.
So the first device you had and the Theracane and those types of things are at Flamin Fitness?
No, the first device, I don't know where I got it. This kind of thing, It's very old. I've had it for a long time and I honestly don't remember where I got it.
Garage
But
sale.
Glam and Fitness
Check out
is a good
garage
place
sales.
to check. And I
Okay.
don't know, Donelda and Saskatoon, do you know?
I'm going to do some Amazon searching and get back to the
Yeah,
group.
that was
if
good. That
anybody
was going to be my suggestion. You may be able to find things online. I know
Yeah.
lots of massage therapists and interdisciplinary offices with, perhaps with chiropractic and acupuncture. They often have products that they sell.
Oh, someone said
self-massage.
surgical store in Regina.
Okay,
Okay.
perfect.
So-
Okay.
So we
One
just
of
have
my
a couple
favorite
more minutes
things
here.
Okay. One of my favorite things for my neck in the suboccipital region, and I know there are a million things out there for your suboccipital region, but I have a yoga block because I teach yoga. And what I do is I get it underneath that suboccipital area. I find the spot and I'm laying down on it and I can adjust. And again, I can move into it. So I'm moving to one side, I can hold it. I can move my arm potentially, it might change it a bit, and then I can move my head to the other side. Sub-occipital release, so important. You can get something like a rolling pin and just lay on it. You can kind of use it too as a sub-occipital release and just pull it up. Give your neck a little bit of a stretch. You can use, I have a little wooden ball that someone gave me, but you could use your sock as well. And for your glute, get it into your glute area. For the people that have hip pain, this is amazing. And just hold it. And then, so I'm finding my spot and then I can move my leg too. So a little bit of movement tends to help release it. And that is the spot. Man, I could do this for another 5 minutes. That feels great. Okay, so we can go on and on. I could show you 10 million other things, but I think I'll stop there.
Erin, I think we need a special for you, like a special movement session. I'm getting lots of thumbs up. And so somebody had commented when you were doing the black thing that you were rolling on your leg, a rolling pin might work. So rolling pin works well.
Yeah.
And someone else asked, can you use these tools on adipose tissue?
I'm sorry, can you use them?
Use the tools on the adipose tissue.
Yes. Yeah. Well, you mean your abdomen, your fat?
Yes, I think that's what they're.
Yeah.
The question was for me, Erin. Sorry.
Okay.
It's, I have lipedema in my legs, and the adipose tissue there it is really like hardened, and I find it really hard to get in there, but it's also painful. So I was worried if I used the tools, I would hurt myself more. Can I use it on that?
Yeah. You know what? With specialty things like that, always ask your doctor. And if the doctor gives you a go ahead, yes, you can definitely experiment with it. And you don't have to, like, I was hugely nodding my head when Donelda said it doesn't have to hurt. It doesn't have to hurt in order for you to get a good release. If you have chronic pain, sometimes just touching yourself is important. So you say you have lots of chronic pain in your elbow, just take your hand and touch it. So your body learns this is okay. It is okay. This touch is okay. And then when that calms down a little bit, you can gently move, even just the skin, it doesn't have to hurt. Sometimes just a touch is important when it comes to chronic pain, and your body gets to learn that touch is okay.
Thank you.
Okay. And so Susan found it on Amazon, so super duper quick. So she put the link for the thing in there. Donelda put, this was great, Erin, excellent advice about adding movement to self-massage and using a variety of tools, including those things from around the house. Susan said, I have to find a lacrosse ball. The lacrosse ball works wonders when you're doing the thing with the hip. I do that probably every single day after I do my rowing workout because my hips get tight from that. I wanted to show you the happy thing of being my home office is my home gym. This is a big thing you can buy. I bought this at Winners for rolling out after working out. I use this for my legs. Aha, you've got the same deal. Mine's
I have
short,
two
so-
sizes actually.
Yeah, so mine's
I have
short,
two
so-
sizes actually.
Yes, and I have a hard one upstairs that my kids use after dance for rolling out after. So yeah, so yes. So thank you. Okay, any other questions for Erin? We've gone a little over time. My apologies. I'm a bad facilitator for that. I like to let people talk. So I'm a mental health therapist by training, so I like to let people talk. Everyone's stories were so fantastic. Okay. Well, thank you so much to Dr. Gowan, to Don, and to Erin. And I'm sorry, Don, again, for aging you, for sharing your time and expertise with us and insight this afternoon. A huge thank you as well to those of you who joined us this afternoon and with your fantastic questions and very insightful comments. And I appreciated that. One takeaway I'm going to take is, Don, when you were talking about walking and being mindful when you're walking, I talk a lot about that to my clients. And I used to be like you. I used to put my headphones on and put my toque on in the wintertime, and I would just be out trucking and I'd be like, I just got to get this done and get on to the next thing. And I've really started to appreciate more what's outside as we move forward. So it's wonderful to be more mindful when we are active. So just a little bit more housekeeping. Recordings of the webinar are going to be available on the SAS Pain website. A link to these will be shared with you by email. An email will be sent tomorrow with any slides that our speakers will be sharing, handouts on the activity, or any other helpful links. It'll also include a link to an evaluation. Please be sure to complete the evaluation and provide us with your feedback. It helps us to tweak what we're doing and how we deliver pieces of the seminars. Our next webinar is scheduled for Tuesday, December 14th at 6:30 p.m. at supper time, and our theme is healthy eating and nutrition. So that is wonderful. So you can learn about something and then have a late supper. And please share any information about this webinar with your family and friends and social circles. That's how we keep getting new people coming on. And I very much appreciate that. There is also a podcast called Your Partners in Pain that you can check out, and it's on the podcast sharing service on Spotify. That's where I found it. It's on the Apple podcast list. And yeah, so check that out too as well. And thank you again so much for joining us, and we hope to see you again on the 14th. Bye.